The community dental service has been established for well over 100 years in one form or another, originally to treat children with poor oral health. Over the years, the community dental service has changed, and its remit now is to treat patients with special care. So that's patients who have physical, emotional or mental disability. It also provides a safety net service for patients who are unable to access NHS dentistry because of lack of local availability.
The patients with special needs are referred into the service either via letter from their dentist or their doctor or another healthcare professional. The dental access patients call in through a dental call centre and are able to access our service.
Other services it provides are school screening and epidemiology, where it informs local policymakers on where dental services need to be provided. Another arm of the service is dental health education, where we go into schools and youth groups and provide youngsters with information on oral health, linking in schools with the national curriculum. Dental access centres provide NHS dentistry for patients who are unable to find a local NHS dentist. There are a network of dental access centres and we're able to offer appointments, hopefully nearest to where the patient lives. When patients phone the call centre, our operator will go through several questions with them. Depending on their answers, they'll be offered an appointment or advice.
When a patient first makes contact with us, what we need to establish is whether it's an emergency appointment or a routine appointment. If it's a routine appointment, we would ask if they have a regular dentist, and if they have, then we would suggest that they try to contact their regular dentist. If not, we would give them the number of the access centres to make a normal routine appointment. If it's an emergency, then what we would ask if they have a regular dentist, and if they do, are they under any current treatment? If not, then we would book them in for an appointment. We need to establish the age range. Obviously children are a priority to us, and also people with swellings. Dental call centre, how may I help you?
Good morning, I hope you can help me. I've been up all night with a really bad toothache.
Do you have a regular dentist?
No, I haven't got my own dentist, and I do have problems with mobility. I'm a wheelchair user.
And whereabouts do you live?
I live in Whitfield, Dover.
Okay, the nearest dental access centre to you would be the Dover Health Centre. It's on Mazendew Road in Dover. The surgery is wheelchair accessible. Whilst this is on the first floor, there is a lift.
The operator will provide information to the patient, such as the address, the telephone number and obviously the appointment, and also provide information on what documentation to take along with them.
Our patients are continually reassured from the initial call at the dental call centre, via reception at the clinic and via the nursing staff, that we will deal with their pain in a sympathetic manner. On arrival, patients are asked to complete a medical history form and also fill in a blue NHS form which entitles them to NHS dental care.
Mrs Martin.
Okay, can I get you to fill out a yellow medical history form for me? Details on the front, then it opens up in the middle for all your medical questions.
Okay, thank you.
Okay.
As the patients are completing the paperwork at reception, the dental nurses are preparing the surgery by wiping surfaces and placing plastic film to prevent cross-infection. When the patient has completed the paperwork, the nurse or the dentist will go and ask the patient to come through from reception. The patient's details will have been placed on the computer, and that information will be available in the surgery for the dentist to access.
Now, once you're up, Sonia's going to move the wheelchair away from you.
The Dental Access Centre sees patients who have often not been seen for a long time. Some of these patients have a very high level of dental disease. Our dental staff are very good at managing patients who are anxious and in pain. They are also very supportive in turning around dental health of patients with high levels of dental disease.
I'm very phobic of the dentist, not fearful, phobic. There's a big difference, and I've always found the staff and the dentist very, very good, very helpful, very calming. The dentists and the nurses have been absolutely wonderful. In fact, over the years they become well, fairly good friends.
The special care dental service is consultant-led. The staff who work in it have additional training and qualifications and can take their time over treating patients who have a psychological, social or physical disability.
Patients who have special needs are referred from their dentist or their doctor and usually referred by a letter. They can also be referred from other healthcare professionals.
And Natalie, we're just here to have a look at your teeth today.
Natalie was referred by another dentist for special care dentistry. She is a very anxious patient, but she also has a complicated medical condition which requires consideration in providing her dental care. To provide special care dentistry, our dental nurses, therapists and dentists have extra postgraduate qualifications or training.
Right, 8, 7, 6 are missing.
Our staff work very hard using behaviour management techniques and also in gaining rapport with patients.
Natalie, I should have asked you today, when you came to the dentist, how did you feel today?
Smiling.
Did you? That's good. That helps us to measure how you're feeling and gives me an idea of how nervous you are. Do you have any questions about today?
The special care dental service provides a service for patients who had been otherwise unable to access NHS dentistry. The patients are often more complex and require specialist support services. These patients may require extra time, sedation, or general anaesthetic to provide their dental care. Ryan was referred for extractions by his own dentist. After an assessment for general anaesthetic, it was found that that was not suitable and he had his treatment with sedation. Patients like Ryan and Natalie require dental staff who understand their medical condition, are able to reflect on it and provide appropriate care.
I've got 3 children and 2 are autistic with severe learning difficulties, and my oldest daughter was in a very low point in her life. Because everyone was really focused on what Hannah needed and everyone was working for Hannah, it was like a very special day. It was like, I'm not exaggerating by saying it was like a wedding. It was like someone's 21st birthday. It was that special that day. And up until recently, I know this is a couple of years ago now, I would get very emotional talking about that day because nothing that I've experienced with my child's disability has ever been that good as what that day was.
Another arm of our service is the domiciliary dental service. This service provides dental care to patients in their own home. Patients are referred from their doctor or their dentist for domiciliary care. A dentist and her dental nurse will attend patients in their own home.
We took some impressions last week, and we've had a special tray made to do another impression of your top ones, so that it gets into all the nooks and crannies. And then we've got 2 bite blocks, right? 2 little wax rims, which we're going to put in your mouth, okay? And we're going to see how you bite.
The domiciliary dental service is valued by patients, their carers and patients' family. This service is also a very important aspect of what we do.
And you told me that you've had these teeth for 35 years. Yeah. So they're really good friends of yours, aren't they? Here we are, right. Let's be very quick. Can you lean back again then? Well done. Open really wide. Well done. What happens is this will actually get into more nooks and crannies because this tray was made specially for your mouth. Okay. Brilliant.
Oh, I think they're wonderful. You're absolutely gifted, all of you. You're just like my friends. I think you're wonderful.
So take care, look after yourself, okay?
Thank you, darling.
Right.
Lovely to see you again.
Okay, bye-bye. Bye. There we are. Okay, we've got everything.
It's a wonderful thing, thanks to your team, that I'm now going to have teeth. I'm really grateful.
Children who are either young or have a special need are also referred into the service. Our staff are trained in techniques in dealing with children who have fears of dentistry. We either can use sedation or just tender loving care so that the children will eventually accept the dental care they require.
Bethany, on her 5th birthday, fell over at school. When I picked her up, she was bleeding quite a lot, and I realised that 2 of her teeth had been pulled back. So they said, right, we're going to refer her to the Dover, where they're trained in helping children. It's totally invaluable to have a dentist that knows children and knows exactly how they're going to react to everything and what to say and when to say it.
Oral health promotion services are provided in schools and nurseries. Healthy eating is promoted, low sugar diet is emphasised, and the use of a fluoride toothpaste is encouraged.
If we brush straight, oh, does that brush the pink bit? No. And the pink bit's our gums, and we have to brush our gums.
Through the use of models, pictures and film, children are taught the importance of good dental health.
If you want a happy smile, brush your teeth. Shh, shh. If you want a happy smile, brush your teeth. Shh, shh. If you want a happy smile, like a great big crocodile, snap! If you want a happy smile, brush your teeth. Shh, shh. Brilliant! Give yourselves a clap. That was really, really good. Wasn't that good?
The skill mix involved in providing a single patient care through a clinical care pathway is immense. The number of people involved in providing a single patient's care is often 14 or more. Our managed dental service is able to provide dental access to patients, whether they come through the call centre or are referred via another healthcare professional.
We've had to change over the years, and we've responded to the population needs. We now have a call centre, we do home visits, and we'll continue to respond to the population's needs in the future.